clinicians yet. You had some clinical experiences before you went on a trip. How do you think that it might have changed now that you're almost going to be a licensed PT? How you might change your practice ideas based upon your experiences? Or would you?
Well, I think I just know I'll be more patient and I won't complain as quickly. What, we can't get this done right now, or we can't have this diagnostic test? Those people, I mean, I was working in the Black Lion Hospital, the biggest one in Ethiopia, and just their creativity with the resources they had. For example, obviously many of you know bed sores are a big issue in the hospital, and they don't have the resources to position the patient to keep them safe. So one thing they did, they had rubber gloves. They just blow them up in these big, almost like a balloon, place it under the leg, and that was their way to prevent a sore on the heel. Just little things like that that we would see all over. And I think just their sense of community, of group, almost teamwork, was almost inspiring to, yeah, I really need to talk not only with my peer physical therapist, but other healthcare professionals, and incorporating the entire family just for the best overall care of one patient, which they did a great job of incorporating their friends and family in their care.
The other thing we were talking about before when we were here earlier discussing is that you really look at patients differently. And so, you know, before maybe you look at a patient and you see them as having this particular diagnosis, and their culture may not be very different from your own. But now you go here and you treat some people who have all these obstacles to care, and their culture is very different. And maybe exercising isn't a normal part of their culture, and so you have to understand that. And so now in the United States, you know, we have the chance to treat all different patient populations and all different cultures. So you have to understand what it is about their culture that's different. And then you have to address that when you're treating them, whether they're Hispanic, white, and there's a huge population of Ethiopians in Denver. So you really have to understand the whole person and where they're coming from before you can have successful treatment. And I think that's the biggest part.
And I just want to reiterate a little bit on what Kristen said about being creative and tell a little story. So I worked a lot with a hand therapist when I was in Ethiopia, and all we really had to work with was plaster of Paris. And so he would make these splints that were amazing, and he would dream about them at night. He was one of the most dedicated people that I've ever met. We would come and see a patient, and he'd be like, how can I make this work? And then he would go home, and seriously, all night he would dream about like different splints. And what he did is he would take the plaster, and then he would take the band from the outside of his glove to make rubber bands out of it. And then he would rip pieces of cardboard off of the box from the glove to make slings for like the fingers, to stretch the fingers. And he would take pieces off his shoe or tear a piece off of his shirt to make different ties. And so these patients would walk out of here with these splints that were just multicolored and full of all these materials, but they honestly did just as much as like a perfect plastic splint that you would find in the United States. And I just thought that was absolutely amazing to see the things that he could do with such little resources, and how much he cared about his patients to actually like tear his own shirt, which he only had 2 or 3 that he wore alternating days, and he was tearing part of it to make a better sling for this patient. So I think that's something I always carry with me. And so when I see patients, not only will I try to be more creative with how I help them, but I'll also remember his passion that he had for those patients and try to have that as well, and try not to get angry at my patients, because that's one thing I think all of us have now, is when we come back and someone's complaining because like a little edge of their splint is like rubbing on their arm or something, you know, and we're like, we really want to say like, are you kidding me? But we have to like take a step back and realize that that's our culture, and so hopefully we can just be more creative and help tell them how to make it more comfortable, but keep in mind how lucky we are that that's our biggest complaint. So.
And I guess for me, I work as a nurse currently, so I was like in the hospital, to Ethiopia, back in the hospital, and I guess just kind of connecting with people on a more personal level too, like not prejudging people based on anything that you see on the chart or with their diagnosis, or oh, this one's a real complainer or whatever. You know, just seeing that you don't know what people go through in their lives, and you really have to take a step back and kind of rethink and just reset before you know, meet people and care for people and that kind of stuff. So to me, I think that's constant in the hospital.
Yeah.
One of the things that we hope would happen in this program, because it's interdisciplinary, is that you gain respect for each other's disciplines or professions. You know, in some years we've had health services students going as well as nurses and physical therapists. Did you get a chance to work together much actually in clinical settings?
I don't think in clinical settings so much. I think, well, I mean, we all visited the Mother Teresa Hospital together in the Fistula Hospital, and you know, I learned a tremendous amount about physical therapy, definitely. And then especially like at the Fistula Hospital, we were talking about there's like a whole new role in physical therapy for treating like women's conditions. And I had never even heard of that. And as like a practitioner, especially knowing that there's treatment from PTs for that, that's huge. I mean, I think that's a huge thing to think about.
So what can we do to strengthen that piece of the program?
I think it was just the timing, because we were there, the PT students were there for pretty much an entire month, and we did our clinical rotations at the front end. And then the nursing practitioner students came toward the end when we were going up to Project Mercy, where we spent most of our time doing more service learning, not really working in the hospital there. Although we did get to treat some of the kids, which I think that's an opportunity for further growth. So whether or not we coordinated clinical there, it's just really the timing of it.
But I think an important piece to say is that when you're in an experience like this, it's something like you've never experienced before, so you connect with the individuals. So even though we weren't actually in the clinic together, we had all our meals together, we did all of these trips together, and so we sat around and we talked. And they told us about the things that they saw in the hospital and how they related to the physicians and what kind of impact it had on them. And we did the same. And so at night we would have these discussions about the things that we learned. And so you're still learning from each other even though you weren't actually standing side by side in the clinic. And so I think that's really important as well. I mean, we would never have known each other had we not gone on this trip together. And so now we can continue in Denver to have a relationship together and understand a little bit more about what each other does. So nice.
Thanks.
You had referred to the importance of knowing the culture. I was wondering if you just talk a little bit more about how did you become familiar with the culture in order to build the relationships that you needed to?
What's that? Yeah, I mean, first of all, we had two amazing drivers, and they were sort of, they would drive us all over the place and sort of looked after us, and we would have very long discussions in the car about the culture, about why this, why that, and I would ask questions, you know, why does that woman have a shawl and her whole head's covered where this other woman is not covered at all, and it's differences of religion and ethnicity and all these different things. And the other way was just, when you work with patients, you build a relationship. Ellie and I were lucky enough to work with a gentleman who actually worked at the hospital, and we treated him, and he had a stroke, and he was rehabilitating from a stroke, and he spoke very good English. And he took us out to coffee, and we got to know him really well. His brother lives in Ohio, actually, and he gave us a letter sent to him. But that's how you get to know the culture, and just walking around and immersing yourself in it. First of all, when you find yourself in a rural area of Ethiopia, I mean, you're the only Ferengi, which is a white person, as far as you can see. And so right there, you're going to be immersed in it and start to understand it. So.
The people were very hospitable. The physiotherapists we worked with at Black Lion became quick friends. We went to lunch with them, even went out with them at night a couple times. Learned some of the shoulder dancing we like to do. I can't demonstrate, so now
Can I cut in?
Yes.
So before the students go, they alluded to in the very beginning that they take a 6-week or it's 8-week long global health course. And so they get information and education about what it is to be a global citizen. And some of the discussions are specifically targeted towards Ethiopia. We also have students in there who are going to the DR and Nicaragua, so we had different focus groups focus on that and cultural expectations. And so there was a lot of prep work before they even got on the flight to Ethiopia on certain things to be looking for, to ask about, and things like that. So the prep work actually started before they left.
We had specific seminars as well in addition to class with the group to have a lot of those discussions. There was reading and all that kind of thing to help get a sense of what the culture is like, what to expect as well.
And the final part was that we do a retreat as the whole group with the faculty and the students and former students. Sometimes